Hi, this is Dr. Sara Siddiqui, and I'm here to present to you my Facebook series and through the Elwood Public Library. I'd like to welcome everyone to this month's topic. It's called Toilet Training in Children, and let's get started. So I would like to thank the Elwood Public Library for allowing me to come on and talk about different topics. And if anyone has a topic that they were interested in that they would like me to present on, please contact the Elwood Public Library reference desk and let them know. And if you have any comments or questions, you can always contact them as well. So I have no disclosures to identify, and this talk is about informational purposes only, and please talk with your physician or medical provider for any specific medical advice. Thank you again to the Elwood Public Library and to Eric Schmidt for editing my talks every month. Questions or comments, please contact the reference desk at the Elwood Public Library. So I want to start off with a quote. Let me pull it up here. So all parents of toddlers will understand that you know your potty training when you have a potty in the kitchen and candy in the bathroom. And that's by Huggies. So. Okay, so I just want to kind of outline what we're going to talk about. So we're going to talk about when to begin and signs to look for in your child, what parents can do to prepare, what some of the items that you may should have or think about having when you're in the process of toilet training, what to avoid. This is a big topic that I go through in my practice. And then what to call your doctor about or check in with your doctor if some of these happen, and then explain some of the hygiene topics to your children too. So is my child ready? Well, it depends on a number of factors, mainly being some physical and developmental milestones. Is your child able to walk and sit on the toilet? If there's a stool there, can they climb up and sit on the toilet? Can they pull down and pull up their pants? Can they do fasteners? And can they stay dry for a couple of hours at a time? Sometimes they start kind of pointing to their diaper if they're wet or dirty. They start kind of, having different ways of telling you that they're interested. They might start sitting on the potty with their clothes on, or kind of following you into the bathroom sometimes. So those are all things that your child may be interested. Usually it's from 18 months to 3. What I try to tell parents is to kind of wait till they're really interested. So you don't want to push it. You don't want to, force it, definitely not. But you do want to just be aware of what your child is doing in terms of bowel movements and wet diapers. And, sometimes they may start talking about having a wet or dirty diaper, and they're interested in what's going on in the bathroom. And of course that they kind of understand and follow some basic directions if you kind of try to teach them different things. Some other things to look for is whether they can communicate effectively. Do you understand what they're, trying to tell you? Are they able to follow simple commands? And are they interested in wearing some big kid underwear or some of the, big kid things that they have to do? A lot of times some children express interest if they're in a daycare setting or in a school setting, nursery school setting, and they see other children going to the bathroom. Sometimes the teachers kind of take all the kids on a big field trip to the bathroom. So those are things that you might want to ask about. If their teacher says that they're expressing an interest, then you may want to follow up with starting at home too. If most of those answers are yes, then your child may be ready. But if not, if a lot of them are no, or you're not really sure, better to wait, because really you don't want to push it. You don't want to force it. You don't want to have a specific timeline. I see a lot of parents in the office that are concerned because they may be starting a daycare or a preschool setting, maybe closer to 3, where they are required to be trained. And I try to tell parents that you don't want to push them. You don't want to have a certain deadline, because it really does put stress into the situation, and sometimes the child doesn't respond well to that. And then if there's any major family changes, like a move or a new baby on the way, sometimes though that is not the best time to start the toilet training process with your child. And then also sometimes if you've already started and things aren't going so well, put it away, stop, and then try again in another couple of weeks or a month, and that's fine too. So what can we do to prepare ourselves? So it really is important for the parents to be ready. Again, there will be some successes and sometimes there will be some difficulties, and that's okay. And if a child becomes a little resistant or scared to go onto the toilet or anything like that, then it's okay to stop the process. And it really should not be a forceful or stressful environment. And again, start keeping those doors open when you yourself or as the parents go to use the restrooms, because it's important for them to see what you're doing. They really do like to model whatever your behavior is, and it's important to do that. The disposition of the child is also an important factor. Are they more interested in communicating, or are they, if they're cranky and upset or tired or hungry, they might not want to use the bathroom at that time. And if they're not really excited or looking forward to the process, then again, it's better to wait. And it's really important to encourage all caregivers to be on the same page. So definitely, both parents of the child, maybe if grandparents are involved, and then you want to include your school provider or daycare provider, nursery school provider, and let them know that this is what's going on at home. And if you could also continue to encourage at school, that would be a great thing. So things to have at home, or what things that you may want to, have. A small potty that you can kind of set up, and either in the bathroom or in the kitchen, wherever the child is playing, and is a good idea to have it out there. You can also have one of those inserts that you put on top of an adult toilet with a stool. You can get the step stool. You can get a portable potty for road trips and things like that. Sticker charts are really important because you want to reward positive behavior and really do not emphasize any negative behavior. That's for, any kind of negative you don't want to really put emphasis on. You may want to get some pull-ups, some new underwear. The pull-ups, however, I usually don't recommend those to use at night because they are not really absorbent. And sometimes children do get rashes if they urinate or dirty their pull-up, because they're meant to be not as absorbent and can kind of stay on top of the pull-up area. So it's really more to inform the child that they're wet or dirty rather than absorbing. So I usually say to not use them at night. And then pick up some books about toilet training. There are many, many out there, and put those around the house and start reading those to them if they seem interested. So things you want to avoid: if your child is uncomfortable using the potty, then it's better. Again, I can't emphasize this enough, because sometimes they can be going strong and going and using the potty, and for some reason something may have happened. Maybe they have a hard bowel movement, maybe they had a little bit of pain when they urinated, and in which case they don't want to go in that location anymore. They just kind of refuse. That is okay. You don't want to force, because what can happen is that they hold their stool or hold their urine for long periods of time, and that can also be not good for them, and that can cause a little bit more problems down the road. So it is something that's really important to try to avoid, because they can start stool withholding, and that causes chronic constipation issues, which can be very difficult to change course from, because as they hold it, they have a painful bowel movement yet again, and then that reinforces in their mind that it's the toilet training process that may be causing it, and not that they are holding it. And so what we have to do is recommend to pull back on all training measures and try again in a month or 2 months or so. Stool holding is where the child can hold their stool, but they refuse to go because they're scared to have a painful bowel movement. And the difficulty is that the more they hold their stool, the more harder it can become, because the job of the rectum is to actually absorb water and dry out the stool. And so the longer it kind of stays in that area, the harder and drier it becomes, and it really does become difficult for them to move their bowels at that point. And I usually tell parents there's 2 things that they cannot force their toddler to do, and one of them is eating. You can't really force them to eat. You can give them, food in front of them, but they will be in charge of how much they eat, and you can't force them to stool. So they have to kind of want to do it, and you want to make them as comfortable as possible. Some of these things you want to contact your provider or give them a phone call. If there's no bowel movement for 24 to 48 hours, sometimes, you know your child best. Sometimes some kids have a 2-day or 3-day cycle. As long as it's normal looking and not too hard, then that's fine. But if it's unusual for them to have 2 days where they don't have a bowel movement, then you do want to contact your doctor. If they're refusing to sit on the toilet, or absolutely, not even going near there, if you've already started the process, you may want to talk to them. If they're complaining of pain during bowel movements or urination, if they have bouts of constipation or diarrhea, if they're very angry with the situation, if they're having frequent urination or complaining of itchiness in that area, in the private area, you want to talk to your doctor. Again, stool holding, you can talk to us because we can give you some tips to help. And of course, nighttime training can take a little bit longer. They're not expected to be fully trained at night until closer to 6 or 7 and even beyond. There is nighttime issues that can be that can have a family history, and it usually is genetics. And so the daytime training can happen much sooner than nighttime. And nighttime bedwetting can be completely normal. Even if they're fully trained during the day, it's okay for them to not be trained during the night. It's because sometimes there's some, depending on how deep they sleep, or there is some delays in the communication between the bladder and the brain in some children. This can be completely normal. But it is something that you should talk to us about, because we do some testing to make sure if that's what it is or if it's something else. Again, a healthy diet and activity can impact toilet training. So you want to make sure that they have lots of fluids, and so that their urine is not too concentrated or that it doesn't burn. You want to make sure that they're having plenty of fruits and vegetables, 5 to 6 servings a day. Especially prunes and pears are very good for healthy bowel movements. We do avoid juice usually, but if they are having a history of constipation, you may want to start giving a little bit of juice, which helps to soften the stools. You can mix it with water or dilute it. Activity is really, really helpful. Running around in the yard or outside is really good for them. They should be really active at 2 or 3 or even 18 months. They should be very active. They should not be really sedentary at all. Children should be outside or playing all the time. And foods that can constipate, bananas, rice, bagels, pasta, the fruit and veggie puffs that I've seen some children eat, sometimes that can be constipating. So not all the time, but sometimes I have seen where children become constipated by eating too much of those. So really fruits, vegetables, water, these are the best things. So sometimes children can regress, which means that they have acquired a skill. They've already toilet trained, but they can kind of move back and stop, or all of a sudden start going in their diaper. So if it's with regards to urine, you may want to check with your doctor. Sometimes we do a urine test to make sure that everything's okay. Make sure that because one of the things that can cause urinary frequency, or for a child to go frequently, is if there's sugar in the urine, and that's completely abnormal. So we usually do check for that. Anytime that I hear a child that's been urinating frequently, we want to check for glucose in the urine or a possible urinary tract infection. So these are things that you should talk to your doctor about. But sometimes they can regress and start having accidents if there's a stressful event in the home, if there's a new baby in the family, if there's been a move, if there's a change in the usual daytime activity, a change in providers, a change in schools. These are all things that can cause stress in your child, and that can cause certain types of regressions. And you want to discuss with your doctor if this is happening. And if your child is still resistant, you can take a break after a few weeks. Once you start and we're being successful, or your child is going to the bathroom, you want to schedule potty breaks. So maybe every 2 to 3 hours, try to remind them or encourage them to go and empty their bladder, so that they kind of have a schedule, or they don't have to think about it themselves. Because what happens is they start, if they're in an activity or doing something and they don't want to stop, which toddlers don't want to transition usually, they sometimes hold it and then they forget. And at some point, they're not going to be able to hold it any longer. So once they do inform you that they have to go quickly, go fast and get to the bathroom quickly, because sometimes they have been holding it and they don't have a lot of time before they have to express it. Help your child learn signals, like if they seem to be holding or squatting or squirming a little bit, then ask them if they want to go to the bathroom, or take them to the bathroom. Of course, if they're resistant or they just start getting upset, then stop the process. And you can put them back into pull-ups or diapers if they're in underwear. It's okay. It's okay to stop and restart again in a few weeks if things are getting rough. And one of the last things you want to do is make sure that they understand hygiene, that they, especially for girls, you want to make sure that they learn to wipe from front to back to avoid contamination, and to wash their hands after the use of the bathroom. And for boys, they may want to learn initially sitting down at first, so that they can become more comfortable, and then they can start standing and urinating. But definitely it's something that should be explained and taught to them. And this is so important. You really want to accentuate the positive behaviors. That's the best way to get results for the behaviors that you want. Celebrate the successes, and the disappointments you don't want to spend too much time on, because sometimes even attention to the negative behaviors can produce increase in the negative behaviors. So you really want to make sure that you don't pay too much attention to the disappointments while really celebrating the successes. So again, candy in the bathroom, that's fine. Make sure that they get some reward for doing what they're supposed to be doing. And once they're successful, have them switch to cool underwear brands. There's Marble and Princesses and all sorts of things that you can get. And it's a nice, fun way to reward them. Again, regressions can happen. It's okay. Please do not punish or anything like that, because it's really not their fault. They just, toddlers it's their world, and we just happen to be in it. I don't know if anyone's heard me say that before. I say that all the time in my office. It's their world, and we just happen to be in it. And that's just how their brain works right now, up until maybe 3 years old, when they don't understand that there's other people around. And that's their brain process. And sometimes regressions happen. So it's okay to stop and restart again. And these are just some of the references. If you wanted to click on there, there's lots of resources. There are also a lot of books that you can check out from the library and read to them, and that's one of the best ways to really teach your child is reading to them. And again, I thank you. I really have a great time doing these talks. I hope that someone is getting something out of them. If you have any questions or comments, please contact the Elwood Public Library. And again, I'd like to thank them for allowing me to present to you every month. So we're gonna stop sharing and have a good night.